Cycle number 2. Generally by this time the client has some tone that's been reduced and it's a little bit easier to drop it down. In this case you can see that she is dropping it down more significantly. Here by number 8 or 10 you would expect that she's able to reduce it all the way to the green, although some clients have difficulty with that. Once you've completed the spasticity reduction program and the patient has the potential to facilitate some movement, then you can go to the motor control program, motor control down program. The motor control down is based into 3 phases where the patient is required to flex to a goal, relax to neutral, and then extend the wrist. It's in the form with a guy with a thumb, or at least with a barbell. You can select the difficulty over here from 1 to 10. The difficulty is represented by the amount of movement required to achieve success in the goal. From 3 degrees at level 1 to 30 degrees at level 10. You can also change the amount of cycles required for the patient to perform the task. And the angle is also represented. Once you press play, the patient will be asked to relax. It will be taken, her hand will be taken to neutral. She's asked to grip down and relax, and then try to pick it up. Keep trying, Miss Freddie. Notice the harder she tries, the greater the tone. The greater the tone, the more she has to fight. So it's important here to ask your patient to relax as well and kind of work it out and find a balance between reducing tone. If it doesn't succeed, it stretches all the way up. In this case, what I'm going to do is make it easier for her. You can hit pause if you feel that your patient is not succeeding with a particular activity and you're going to change some of your components. You can pause it and you can make it easier for her. We're going to make it a 2, a level 2, in which case the degrees required to achieve success are going to be 6 degrees. So let's try it again. This time, Miss Freddie, relax. Now grip down to pick up and relax. Pick up the barbell and now pick it up. Good job. Nice work. And relax. Good enough. You have the option when you change the difficulty that the level of activity is represented by the amount of movement required by the client to move the device. At a level difficulty of 1, they're required to move at 3 degrees, and a level difficulty of 10 required to move at 30 degrees at its greatest amount of movement. Once your client has achieved the ability to relax their tone and is showing the potential to increase or activate those extensors, you can go to the motor control up. Essentially, the premise here is to move the wrist to neutral and then actively extend it up. Obviously, the same applies in the amount of assistance or difficulty. The difficulty is based on, at its lowest, 3 degrees for your patients who have just a trace amount of extension, and then your patients who have more extension in the way of 30 degrees. In this case, we're going to make it a level 2 because we know that's kind of where Miss Freddie is. And we're going to do 10 cycles. When we press play, the barbell will be picked up. She has to relax her hand to start. Let's get our positioning right. Good. She has to relax and simply pick it up. And then relax. And it will continuously go, and then she has to extend. That's important. The more that she extends, remember the tone will increase. So it's important to continue to encourage your patient to relax that tone in between activities and consciously reduce that tone so that she can learn functional grip. As you progress and you learn how to reduce your muscle tone and you learn how to relax or control your amount of muscle tone after you grip and you've got your extensors working up and down, then motor control becomes a challenge. And the ability to integrate both the flexion and the extension of the wrist in the game format. And that's what the advanced motor control is designed to do. When we select that, the patient in the game format is required to perform flexion and extension based on getting the balloon to fly. We're going to start on difficulty 1 with the speed of slow. Let's get our positioning correct. Make sure that all of our straps are good. Miss Freddie, we're going to go up and down based on this little balloon. He's on the ground. If you raise your wrist up, the balloon will go up. If you raise him down, he'll go down. You got to try and stay away from the birds and the airplanes.
Oh gosh.
There you go. So the idea is motor control or cognitive control of those particular muscles when you need them. It's easy to sit on the ground though, isn't it? Good job.
Oh.
Now she has to raise it up. And so, go a little more. Good job. And so the premise is a synonymous flexion and extension. Due to the visual motor integration component required to be able to perform this exercise, there's a very strong problem-solving component, especially at the faster speeds. And so you have this environment where flexion and extension is created, and where it becomes really hard. Now relax that tongue, remember? Relax that tongue. Control that hand. Easy, easy. Concentrate. Oh, you're playing with fire.
Yeah, but if you don't get up there, some of them ones come and you can't get through.
There you go, nice and easy. Watch your extensors. There you go. Relax. Nice. Control it. Feel the force. Up. Nice. Stay there. You also have the option to collect the data for the patient on a USB port. This is taken to a computer where the software is uploaded on the computer and you're able to look at the charts. To do this, you have the USB port that you plug in. Once plugged in, select Tools, and you copy your database to the USB drive. Simple as that. Press OK. And that data is now on the drive that you then take to your laptop. Go back, and you're in your claymation mode, and you're ready to continue.